Hi, I'm Dr. Tejasvi.
I'm Dr. Karthik Surya.
Hello, I am Dr. Shapna.
Andaman and Nicobar. When the name flashes, everybody thinks of a holiday. But have you thought what would be the kind of medical assistance the patients get in those islands? We found a child coming to our clinic, Shamla Clinic in Andaman, with history of breathlessness and generalized tiredness. So on examination, found a small murmur, which is usually indicative of either a small hole in the heart or a valvular problem.
Dr. Shapna, Dr. Tejasvi, and myself had a meeting where we discussed the various modalities of treatment that are available for this child. Earlier, the child would be subjected to a surgical correction wherein the child would have an open heart surgery where all the conditions would be treated, namely closing the hole and expanding the narrowed valve. But today, we are able to do that in the cath lab without the need for a surgical procedure.
Baby Edel presented to us from Andaman for a ASD device and a balloon pulmonary valvotomy in the cath lab. When I went to see her pre-procedure, she had a mild running nose due to the weather change. Since this provides a risk for anesthesia as they can go into laryngospasm, we decided to wait for 2-3 days, optimize her, and then take her for the procedure.
This child then underwent a catheterization procedure wherein the hole was closed by means of a device called the atrial septal occluder, and the narrowed valve was expanded using a balloon. Both of these were carried out simultaneously through a small opening in the groin, and the device as well as the balloon was taken through the opening in the groin, and then the hole was closed and the balloon expansion of the valve was done. This was carried out successfully in the cath lab, and the child had a very short recovery period.
During the procedure, I ensured that sedation was given outside the cath lab, so the risk of parental anxiety was decreased and the patient was comfortable while shifting to the cath lab. Vigilance was ensured during the procedure to maintain the vitals and hemodynamics and saturation. Especially when the balloon is inflated, there is no blood flow to the lungs and there is a brief period of desaturation for which we ensured pre-oxygenation was done.
After this comes the financial implication, which any high-end procedure incurs. Give a Hand Foundation was able to establish the rapport with the child and then see their condition and give the financial support. So such kind of procedures which are high-end are done in Sooriya Hospital, Chennai, with all the heart team involvement. We have cardiac surgeons, we have cardiac anesthetists, and the team of cardiologists who handle every cardiac emergencies and every high-end cardiac work with utmost precision and care.
The entire exercise could be carried out without a hitch because of the presence of some very good specialists, namely Dr. Shapna, who is our anesthetist, and Dr. Tejas, who is a cardiac surgeon, and are required the state-of-the-art infrastructure, which is the cath lab and the modular theatres, which gives us immense confidence to carry out such procedures with ease. Much can be said about our management, which supports us in all our endeavors to carry out such complicated procedures. We are eternally thankful to our management as well.
मेरा नाम एंजल है। मेरे बच्चे के नाम एडलिन, 4 साल की बेबी है। हम लोग अंडमान से आए हैं। बच्चा का हार्ट प्रॉब्लम है, तो अंडमान पे हार्ट के लिए कोई फैसिलिटीज़ नहीं है इतना ज़्यादा। सूर्या हॉस्पिटल से डॉक्टर तेजस्वी सर आए थे। सर मिले हमसे। सर बोले कि सर वहीं पे चेकअप करके आप चेन्नई आ जाइए सूर्या हॉस्पिटल में, हम लोग वहाँ पे ट्रीटमेंट बच्चा का करेंगे करके। आके बच्चा का आके सूर्या हॉस्पिटल आ गए, चेन्नई आए। जिस दिन से आए आज तक सारा बच्चा का आके ट्रीटमेंट बहुत अच्छा से हुआ। सारा स्टाफ, सारा नर्स, जितने भी है, सारा जन बच्चों को बहुत अच्छा से केयर करे। सूर्या हॉस्पिटल के सारे स्टाफ एंड डॉक्टर सबको लिए धन्यवाद करती हूँ। बहुत अच्छे से हमें केयर करे, मेरा बेबी को बहुत अच्छे से देखे, इसके लिए सबको धन्यवाद। सब बहुत अच्छे, हेल्पफुल और दिल से बहुत साफ है सब, इसलिए सबको धन्यवाद करती हूँ। Thank you.
because she's now completely cured. This is the very few conditions in heart where you completely cure the patient. இப்போ ஏர்லைனுக்கு இருந்த ஓட்டைக்கு அந்த இது ட்ரீட்மெண்ட் பண்ணதால இப்போ கம்ப்ளீட்லி நார்மல் பர்சன்.
Seeing the child happy and healthy at the time of discharge was a very satisfying experience for me and my team.